our sixth episode of Coffee with a Side of Healing. Thank you all for joining us again. Nice cup, Brigida. I want to welcome la señorita Brigida, Mr. Manuel Rosas, y la señorita Erika Corral for joining us here one more time and helping us have our sixth episode. So we're gonna go ahead and get started like we typically do. I'm sure you already know who we may be, but we're gonna do it anyway. So we're gonna do something we call popcorn. I'll go ahead and introduce myself first, and then I'll pass it on to someone, and then they'll introduce themselves until we are done. But it shouldn't take us that long this time around because there's only a very few. It's a small group today. So my name is Jaime Gomez. I am with Service Area 7 Administration, and I'm one of the administrative team's community health worker. I'm very grateful to be here for our sixth episode. I feel very proud of this podcast, and again, thank you all for joining us. And I am gonna popcorn la señorita Brígida.
Thanks, Jaime. Hi, everyone. Thanks for having me on today. My name is Brigida or Bridget Salinas. I serve as the Service Area 7 Administration's Health Neighborhood Liaison, Faith Based Liaison, and one of my other favorite roles, the School Based Mental Health Coordinator. And it's so nice to be back amongst my peers and colleagues here at what we call Home Service Area 7. And I'm going to popcorn it off to Manny.
Hey, good afternoon. Thanks, Bridget. My name is Manuel Rosas. Call me Manny. I am the Service Area 7 Chief with the Department of Mental Health, and I'm glad to be back and being a part of the podcast. And I will popcorn it over to Miss Erica.
Thank you, Manny. Thank you, everyone. So good to be here, and I really hope that everyone takes great notes of this great podcast that we've been planning so hard. So my name is Erica Corral. I'm one of the co-chairs for the Great Salt 7, and it's so excited to hear all the great information that Ms. Bridget is going to bring us today. So take a lot of notes.
Thank you, everyone. Thank you, Bridget, Manny, and Erika for being here again. I can't express how grateful I am to be able to do this for the community and just to be able to share resources. I do want to kind of not start off right, but I'm sitting here trying to think like it was 2020, Bridget, when I last saw you, right? I think I had just joined the department, and I met Bridget, and we were starting to come up with a lot of ideas as to what we wanted to do. And I think for me more, it was quite honestly the introduction coming into the administrative team to what necessarily school-based mental health was, what that component was, and what we did. And I remember amongst other projects, right? It was school-based mental health, and I remember all the great work you were doing. And then all of a sudden, you were deployed, and now you're back. So how does it feel to be back? Number one, I'm not sure what you want to share with us about that.
Yeah, Jaime, I know it's so nice to be back. Time flies, lots of work to be done with Service Area 7 and even with the community at large. And, it's funny because transitioning back, I feel like we picked up where we left off from. And in addition to that, I've even been able to see a lot of our thoughts, dreams, ideas when it comes to some of the needs for Service Area 7 come to fruition. Even getting up to you know, up to speed with like the time. So it's a very exciting time to be back, a very exciting time when it comes to helping address some of our school-based mental health needs and, really hit the ground running. But yeah, time flies. When I transitioned out about a little over 2+ years ago, I was deployed to serve as a disaster service worker with the Veteran Peer Access Network, also known as VPAN. I had the privilege of seeing such great staff do disaster service work, and it was such an honor to represent Service Area 7. Um, Staff from like the directly operated clinics, as well as some of the administrative colleagues who were able to respond to some of the needs, not only in Service Area 7, but countywide as it comes to veterans and military family members. So it's really nice because coming back to that, even being able to fold that into like some of the other duties and responsibilities, like the health neighborhood, has been so nice. But getting up to speed, as I had mentioned before, time flies, but I feel like so much to catch up with, with all of these great
Mhm.
changes, microsites that I know that we're going to be chatting about in a little bit, the vision. I'm, hearing Manny and some of the ideas and how we're going to really be able to address some of the needs and work collaboratively with Service Area 7 community based organizations. It's just such a great time to be here. We're wrapping up the school year, which means this is a great time to really rev up for summer and also
Mhm.
prepare for the fall school year because as we know, fall is right around the corner. So ensuring that, we're working collaboratively to discuss the issues at our school sites, with our districts, within our network, and being able to share resources to work collaboratively, and becoming being able to make this transition as effective as possible in order to support the needs, right? Because we work together in Service Area 7. I think one of the things as stakeholders, many of us are from this community. It's in our roots. We serve here, our colleagues are from here. And the nicest thing about that is that, there's a lot of heart behind that. And with that, I know Erika in the past has even mentioned, we're like a familia, right? We're like a
Mhm.
family. And so it's how do we leverage those relationships in order to really help meet the needs of the youth, right? That I have heard, as well as some of the school based mental health collaborative needs. So, yeah.
That is so great. Yeah, I totally agree with you on that, Bridget. And I think it's so good to have you back as well. I think I met Bridget, everyone at the health neighborhood when it used to be face to face. It was little old me that got introduced to the health neighborhood, and she was so sweet to show me where the snacks were and everything because people were starting to get started. And so I always remember Bridget always being so welcoming, and I just wanted to see coming back, like what is the vision and the direction to meet the school-based mental health needs for the Service Area 7, for the students and the family? And like you said, we're all a big family here, but school is so essential, and a lot of us did spend quite a bit of time at the school. So I don't know if you can let us know a little bit of where we stand, can you coming back and seeing that?
Absolutely. Yeah. So in coming back in just the short amount of time of the outreach and engagement that Jaime and I have done, and I know I'm going to also eloquently collaborate with Manny with regard to like this response, but just in hearing some of like the capacity needs, right? And how sometimes some of our resources are siloed, and how is it that we ensure that everyone has a seat at the table, whether it's a school district to ensure their representation so the information is going back to the school sites and the information is disseminated, or how do we even use some of like the health neighborhood community based organization or a faith based organization that provides a support group? So it's like, how do we use the existing community to really help meet the needs as well as mitigate some of the risk, right? There are a lot of
Mm-hmm.
themes. May is Mental Health Month. So this is a great time for us to ensure that we are visible and to work collaboratively to meet those needs.
Mm-hmm.
In addition to that, we have a lot of projects coming forth, and they're right around the corner. I know that Manny will clarify and add to that, but we're looking to, look at maternal mental health, also to continue to increase suicide prevention work within Service Area 7. I know in a recent episode, right, of our podcast, we had the SPN team here. Future presenters will also be here. And the nicest thing about that is everything will be tailored to Service Area 7 and our
Mm-hmm.
specific needs, whether it's serving monolingual Spanish speaking families in certain areas, or even casting that net a little bit broader in areas that may not necessarily be represented, right? So Signal Hill, Hawaiian Gardens, right? Ensuring that those communities have a seat at the table. So as we move forward with our vision and direction to meet school-based mental health needs, right? Specifically for Service Area 7, students
Mm-hmm.
and families, it's like this is how we're going to move forward, right? And then Manny, I don't know if you want to jump in and clarify, add any of that.
No, I think you're saying it perfectly, Bridget. And, I do think that having joined Service Area 7 a few years back, some of what we've seen is that we have a lot of great services, but they were very isolated, kind of siloed, as you were saying. And you've done, you started it and then were deployed as a disaster services worker, and you're picking right up at it. But you've been doing great at the work of connecting all of our services and all of our community together, because ultimately it's not just about our mental health providers, but it's being able to really pull together as a community to support one another. If you go back, we're trained as social workers, right? Clinical social workers. Part of it is you start where the client is and you build the entire support system around where the client is. Well, that's basically what we're doing, is really utilizing our community resources, whether that be faith-based organizations or the schools, our mental health providers, families, and our peers themselves, to really kind of pull together and kind of develop the safety net for our community. And in this area, you're doing that related to school-based mental health services, which is pivotal, because that's not only with, it's not targeting just high school age, elementary, middle school. It's like across the age groups. And I know there's even like work that's being done in serving some of our local community colleges and universities. So it's really having to pull all of that. All of that really entails school-based mental health. So it's not a small task by any means that you're taking on, but I know you've been doing marvelous work at getting that started and really building upon it.
And I think too, because of everyone who's having a seat at the table at today's podcast, is something that's really important is that there's a lot of heart behind that, right? Like these are our community, these are our roots. And that is definitely the driving force of, okay, how are we going to shift the paradigm in order to best support the needs, right? And representation is key. So including Whittier Whittier College, reaching out to early start, early intervention programs seems natural to us because we want to ensure that representation is there and that we're able to build these relationships and these partnerships on an administrative level as well as on a direct service level. So really
Mhm.
thinking about, how are we able to really not only mitigate, right, when we talk about addressing like the social determinants of health, right, but how can
Mhm.
we do it collectively so there is a shift so we can start seeing it in the data when we start,
Mhm.
looking at, oh, look at DPH's data and when it's extrapolated. So, like, what does that look like? Oh, hey, you know what? Like the señora down the street said that this is what's going on in the school and it actually like matches, it
Mhm.
jives with the data. So it's like, how can we do that collectively? So really exciting. And, even in, I know Jaime, you and I will tag team on this one, right? When it comes to, how do we cast that net? We use the term casting the net. And it's like, how do we do that? Well, we want to do that by centralizing our resources. We want to make sure that it's accessible. We're realistic about how we're able to connect with people, right? Podcast, right? If you have your cafecito and, your pastry, or, if you're healthier, maybe your uh, avocado toast, and you're able to listen to what your community is able to bring to you, like via a podcast through our microsite, being able to be readily available, whether it's, having a centralized, what is it called? Jaime, help me out on this one. Email address, right? Where we're all
Yes.
able to communicate and it's centralized in a way where it's like, oh, hey, this team is communicating. And so because we have a strong communication, amongst each other and those strong connections, then we're able to then not only model it, but then pass it and take it forth to our community at large. So yeah, go service area 7, right?
Yeah.
Yeah,
It's
yeah.
Bridget, I'm a little curious, maybe if you and maybe you and Jaime can talk a little about this, as far as some of the work that you are all doing, as far as establishing, you're casting that net, but you're also trying to keep that net together. And how is it that you're able to like pull some resources and actually have resources that are useful and with like contact information that is current, and where you yourself can be accessible to the community in case people have questions about school-based mental health.
Eh, I'm not sure, Bridget, if you want to go. I know I can say, Manny, that quite honestly, I've just been trying to be a supportive tool for Bridget. I step out of her way, but I see her needs, and I lend myself to, like, yes, I can do this, or we can do this. In terms of the microsite, again, not to rewind, but I remember prior to Bridget leaving, that was something that she had mentioned to me, and at that point, I think we were more focused on the health neighborhood, and we were trying to figure out how to incorporate it. And while she was redeployed, I was provided with the opportunity to develop the first microsite. Now that she came back, I feel like one of the things that I wanted to bring to task is fully using the site for what it can be used for. So in, I think, one of the first school-based mental health meetings that we had, the providers started expressing the needs for resources and whatnot and what was going on. So we started using the microsite specifically more strategically to be able to be supportive to our providers. In terms of resources, I gotta say, Brigida knows so many people. That's all her. Brigida knows people from everywhere, and she's just reaching out and casting this net. And I'm just trying to be supportive in the sense, like, what do you need me to do to help you keep this all together? How can I help you be that binding glue, right, to keep the team together? What
Mhm.
can I do? But Brigida, she's the star here.
No, no, I think we're a team, right? Like again, we're very like in community, in family. So like Jaime and I are definitely a team. Like we keep each other in the loop. He has ideas, I have ideas. He's able to provide those parameters to ensure that, you know, we're staying within the vision of our leadership. So we both ensure that we're doing our due diligence. So like credit is given where it's due, and so we definitely got to give a shout out to Jaime. You know, while we do our plug for our for the service area 7, the microsite, as well as like the expansion when it comes to the school-based mental health collab. But it's definitely, you know, when we talk about vision and direction, what we're doing is we're leveraging our strengths, right? So, you know, if I have some relationships that I'm able to utilize and Jaime seeing something, so it's like, how can we work to problem solve? You know, Manny was talking about like, you know, as we are social workers, mental health professionals, you know, we come from that lens, right? But then when we look through an intersectionality lens, well, you know, let's look at the cultural issues, let's look at the other pieces, right? And one of the things that aligns across the board is our strengths. So utilizing that strength-based approach, Jaime and I have this great rhythm, as I call it. So as we're doing our plug, right, because it's a podcast and we can do that, as we're doing our plug for Service Area 7's microsite for school-based mental health, it's been a very nice process of how we've been discussing some of the needs and how to look at creative and innovative resolutions, right? When it comes to, hey, this is the issue, right? This is how we usually respond. There's school-based mental health needs. We need mental health providers. Well, the barrier is, you know, capacity is, as I have heard in the short time that I've been back, right? But it's like, how do we ensure our due diligence and training as well as making sure that it's robust so that way, you know, okay, plan A didn't work out. What about plan B? What about plan
Mhm.
C? Right? So it's, you know, as we're doing our plug, it's been great because in the short time that I've been back, I had an LAUSD East psychiatric social worker reach out and she said, you know what, Bridget? She's like, I didn't have your email address, I didn't have your phone number, but I had my smartphone and I went online and I went to the microsite and I found that resource for substance use that you told me about. And guess what? They were linked, they were triaged, and they're being seen once a week. And they also were given the option of a group. And it's
That-
just seamless, right? Because what is
That's
something that's
awesome.
accessible? Everybody has a smartphone, right? I have two. So as we're doing our plug for Service Area 7 and the microsites, especially when it comes to school-based mental health, right? One of the things that we want to ensure is like access. And so how do we level the playing field to make it equitable? And this is one of the things. It's like if you have a smartphone, and if you don't, make sure to check out our resources because we have some free cell phone resources on there. But
yeah.
yeah, ensure that as we were building this network of schools, of, whether it's districts or contracted providers and community-based organization, that we are finding a, you know, a centralized means of supporting service area 7 needs. And our data will reflect that as time comes, because we're seeing a lot of the needs as a result of the COVID-19 pandemic,
Mhm.
and it's shifted. I know I've had a conversation with Jaime. I said it was really interesting because right before my deployment, it was like, hey, let's get those referrals up. Let's ensure that we have policy for telehealth, and it was great. It was like, all right, let's do outreach and engagement. And then coming back, it's like, hey, we have these needs. How are we going to meet the needs? And so it really puts it on us to find out ways to be creative and to collaborate as we start to, work together with the school-based mental health collab. So yeah, exciting times.
Yeah.
It
I
is.
if I may share real quick, what I really enjoy about working with Bridget is that we're similar souls, right? She likes to problem solve. I enjoy problem solving. You know, uh, I enjoy a challenge. Like Manny knows this. Throw it on my plate. It's fine. I know I'm stressed out,
Mhm.
but it's okay. I'll figure it out in my sleep. And Bridget I feel that she's the same way. Instead of harping on the bad things, we try to figure out plan A, B, and C, and if those fail, how we're going to support those and how we're going to continue to support our providers, right? We're providing those services, the rest of the team included, and really always brainstorming. So again, just for me, kudos to Bridget because she's there, she's really doing the work, and she's really like helping out bridge all these gaps together, bring all these things together, and
Mhm.
really helping our service area out.
Ditto, ditto. Kindred spirits, right?
Yes, ma'am. Yes, ma'am.
But I think it's very much needed because you're creating that presence within the community. Then it also brings to have accessibility to those around you, and then it creates something to like, oh, Bridget gave me this resource, and next thing you know, it's already being introduced to the community. So because I think a lot of the times, like Manny mentioned, we want to also meet the client where they're at. So even though we're creating these things in place, it helps to see what the client sees in the community and see how to go about it. Jaime and Manny have always heard me that I always say, if my mom talks about it and says that her and her comadre are doing it, it's already in the community because you're having them talk about it. So I think it's great to see that through the work that you're doing, Bridget, you're bringing that presence and that they are willing to have that accessibility, so it could be more helpful and it's easy instead of like, how am I going to get to this resource? Would I ever get that? And it's like there's things in place. Knowledge is power. It's just knowing how to like connect it. And I have seen you, Bridget, like resources like right away, so it's good to bring everyone, together, but like Jaime said, very centralized that people can access them, especially for a lot of the, PSWs out there on campus that a lot of the times, we could be identified as that mental health expert, right? And you have the resources and you have a system in place. So kudos to you that we're getting it to the community and to the eye level of the client.
Agreed.
Bridget, I'm curious in some of the work that you've been doing recently with like the schools and our school-based providers. Have you seen any, or what are some of the common themes as far as like needs that you're seeing out there, specifically for our region, for Service Area 7?
Ooh, nice segue, Manny. I love this question because I was ready for it. Um, so some of the common themes I would narrow it down to about 4 or 5 needs. Maternal mental health. Um, that's a need that I've just seen countywide, but especially when it comes to addressing the maternal mental health needs of BIPOC here, whether it's Latinx or indigenous communities, right? So maternal mental health. And we have, I know we'll have some conversations to continue to read the room and be able to pitch to our community as to how to best address the needs. Second is suicide prevention, which we've already started to do the work. They've been here on the podcast. We have future presenters who are going to do some great work as well. They're already in Service Area 7, so they're going to pull some of the suicide prevention work through art.
Mhm.
And so that's a plug for an upcoming podcast. The the third one is substance use. And so when we hit the ground running, those are the first points of contact, that I ensured to bring to the table is substance use in Service Area 7. And DPH's core program did a wonderful job to not only create a customized PowerPoint to address the referral process, the screening, and how to link students as well as their families, but they also ensured that they created a centralized provider list to ensure that school sites as well as families could self refer or the school entity within Service Area 7. So it's not like here's a general resource list and a Google. It's more so of like, this is Service Area 7. These are all of our substance use providers, and this is the point of contact. So it's that warm handoff, right? In our community, when we talk about family, and just as Erica had mentioned earlier, it's, hey, I know so and so. And so I know that there's going to be um, the warm handshake, whether it's virtual or in person, right? Because of
Mhm.
telehealth, that I'll be able to speak to and help me address some of my needs. So that's the fourth one. Is that the third or fourth? And then, Jaime, when we were talking about some of the other needs we had recently mentioned because of some of the consults that I did is the needs of co-occurring developmental disabilities. So individuals with developmental disabilities, and that ties across the board, right? Whether um, our Service Area 7 mental health clinical supervisor, Norma, brings up the term IEP, right? And how we navigate um,
Mhm.
the school system and how the collaborative can best support those needs, or ensuring that we are appropriately collaborating with the regional center system, which is very near and dear to my heart. So I can
Mhm.
talk about it all day when it comes to those that we serve in the school and out in Service Area 7. So those are the big heavy hitter topics that I know that we're going to hit the ground running. One something else that I would like to highlight is we are currently in the early stages of looking at the data when it comes to suicide prevention. And when it comes to our schools and our school-based mental health providers, something that should be noted is not only those who die by suicide, but the attempts of those who die by suicide. So we're going to start to look at the data of the school age population, that youth, because I hear oftentimes, whether it's at the town hall or at the podcast, hey, our youth have needs, right? So like that school age, that we're going to look at the pre-K, the little ones, right, all the way until those who are T, who are transitioning to college, and to look at the data of attempts to die by suicide, right? And what the
Mhm.
rates look like specifically in Service Area 7 and how we can do some of that suicide prevention work. So that's to come. We're still looking at the data. It's still being extrapolated, but we're going to start looking at some of the data for Service Area 7. So that's just some of the needs that I can definitely say that we've observed and is definitely going to be folded into the microsite, the collaborative resource work, as well as the vision and the direction that definitely aligns with Service Area 7 leadership, right? Manny's here. Glad to have him here. And we want to make sure that it not only resonates with the community, but it also aligns with the direction that our leader is moving us in. So, yeah, good stuff.
That's a lot of heavy topics there that are, sounds like are coming up within our region, and it's interesting because I think many of those topics that you touched upon really cross over outside of just the school, our educational environment. Because
Mhm.
like maternal mental health, so you're talking about early on, early treatment, early prevention type of work, where as I remember being a line clinician, hearing like, well, how do you really do therapy with like a baby or with somebody who's pregnant, and it's like, well, there's more than that. There's a lot of
Mhm.
support services that go into being able to support early pregnancy and even into postpartum as well. That's huge. But even talking about getting those early supports, maternal mental health contributes into potentially hopefully preventing children from going into the foster care system and keeping families together as well, right? That goes into impacting risk for suicides, right? You're talking about a large these are pretty heavy topics, but it impacts our society as a whole. And one of the biggest things that we keep hearing about is homelessness, right? Our unhoused population, and how so many of these topics, again, that you're touching upon, early prevention, substance abuse, and just, the type of supports that are needed that could quite possibly address the homeless issue, not
Mhm.
currently so much for the individuals that are unhoused, but prevent some future individuals from continuing to be unhoused. And it's
Mhm.
really interesting because some of the latest data that we've seen for our service area shows that the largest growth we've seen for the unhoused population in service area 7 hasn't just been homeless individuals, but families. We're seeing a
Mhm.
lot more families that are being unhoused within our region. That's the largest area that we've seen growth for our region. So it's a lot of topics that are really kind of interconnected, if you will.
Yeah.
I definitely agree, and again, not to do a shameless plug, but I again, not I can't help but think how the website supports everything that Service Area 7 is doing. Part of the concept of the website was organizing all these resources because, like Bridget said, or Brigida said, excuse me, and it's easily accessible to anybody, right? Social worker doing the work, the home team. Now we have a home team page, a home team 7 page on our microsite. We're proposing. I'm going to be working on a PRC page, and the idea is basically to have all these resources that we know exist accessible
Mhm.
to the community because all these things tie in together. Even as Manny was mentioning the maternal mental health, you see me nodding my head. uh, I've bragged about this already. I'm a proud father of a baby. She's 2 years old. But I had been involved and heard some of the conversations previously to my daughter being born. So I understood how important maternal mental health issues can be. Even me as a father, how I could be more supportive to my woman, how I could be more supportive. And I already know the women out there are saying, you can't. I've had this conversation multiple times with my woman, but my point is that really understanding how all these things wrap together, and if we can better put our thumb on this within our service area, then we can better support our service area, right?
Mhm.
Putting these resources out there for our community, providing support to our schools, providing support to our providers, making ourselves more accessible, more transparent. I always joke about how hey, you want to talk to my boss? Go on the website. His phone number is on there and his email, and he will answer. He's going to answer. You may or may not like his answer, but he's going to answer. but
And I get the
I
calls. Thank you very much.
no, no. And just to land, I think, at least in my perspective and my way of thinking, uh, and I guess I really enjoy working for the service area because I can really see us doing great work in the sense of we're actually being more transparent, putting ourselves out there, making ourselves accessible, being supportive, right? Administratively, as I mentioned, I'm the type of person that anything you ask me to do, I try to do or get it done. And I really enjoy that about the team working with everybody here from America, Manny, Brigida especially, but definitely kudos to you. I can't wait to see the great work that comes out of your maternal mental health group.
Yeah, so I think the nicest part about that is like vision, right? So like we ask ourselves, what's the vision for Service Area 7? And I have been privileged because along the way we're able to gain clarification, right, from both the community based on what they feel their needs are, as well as our leadership. So Manny, I know Norma is also part of that. She's our mental health clinical supervisor, but just being able to have those parameters and a good foundation is really going to help us with that driving force in the direction, to meet some of our needs because our service area is very large and because it is quite large, we need to ensure that our net is large and inclusive and that we're able to leverage and work collaboratively to support those needs. So, Jaime, I know that we make a great team, and even part of our even bigger, larger team, right, is the remainder of the admin team, and Eric is in there, Saul, everyone, Alicia, you know. And then, Manny's helping us build the ship as we're flying it, and in grand DMH fashion. But it's definitely an exciting time.
Absolutely. But you know what? I think that like it's we're at a critical point right now, especially through the difficult times that we've been going through over the last couple of years with this pandemic. The just the innovation and creativity that's coming out, how it's this pandemic has really kind of forced us into really becoming more creative with our approaches, and rather than just developing the old school paperback, printing out resource directories that oftentimes that by the time you got a copy of it, the phone number was wrong or the area code changed or the person who's the contact is no longer working at that agency. But being able to develop, I think that again, this kudos to all of you in developing these type of resources where, the example that you gave, having somebody who's at a school with somebody there who is in need of substance abuse services, but their first thought was to contact you who's in mental health, who we don't even, we're not the primary provider for mental health services, but it was like, hey, I know you have the resources, but I couldn't find your email, couldn't find your number, but I knew if I went into this website, I could find the resource there. And obviously, it in this case, it worked out, which is wonderful. But ultimately, that's what we want. We want to be able to really listen to what the community is telling us is needed and develop a tool that is useful, not just something that makes our job easier, but it's something that's going to be useful for everyone. So, I know one of the things that Jaime has worked at really diligently as well is at the microsite and developing all the resources, but making it readily accessible by even like attaching like the QR code and putting that available
Mm-hmm.
where like now we even have that where someone could just grab their smartphone, scan the QR code, and you're immediately connected to our Service Area 7 microsite, and you know what's going on. You know the contacts there. You have access to all the resources. You have access to these a wonderful podcast that you all are doing. So again, it's making that information a lot more accessible, but also current, because that also allows us to update it in real time and make sure like when we're hearing from people, it's like I called that number and that number is out of order. All right, we need to immediately change that. We need to fix that. It really is important, especially in these critical times, again, where people are teleworking, people are switching jobs, and oftentimes the information just changes so quickly. We need to be able to update and provide the community with real-time information and resources because we need them. We really do need them, and we can't wait to leave a message for somebody who's out of the office, Mondays, Wednesdays, and Fridays, and you happen to call on a Thursday, so this is a way for them to really access that information. So it's great work, really great work. Really proud of the work and really proud to be a part of the service area and working with wonderful just people like you who would really inspire leadership and the community and inspire me to really, quite frankly, it's like do whatever we can to just be responsive and support the great work that's being done out there.
I also hear, sorry, Jaime. I also hear a lot of like empathy, right? Because we have all been in the trenches. We're still in the trenches with the community. This is our community, and it's even when it comes to an administrative level, there's that empathetic tone to it. The empathy is there, and so it's like, what are we going to do to be of service to the community? But also, what would I have liked if I were back in that? If I were to jump in a time machine and be back in that position, what would I have liked? Right. And so really setting up Service Area 7 for success has just been wonderful because it's been a process, but it's been a really nice process to be able to collaborate as we're looking for solutions. So yeah.
Absolutely.
It's funny. We could speak about this for hours, right? But I think, like Brigida said, haven't been in uh, have me haven't been in the trenches, right, and working with the community, and I remember trying to dial a number and getting the wrong number and not being able to get access to anybody. Now it's so funny. I know Manny hears this a lot, but it's like you don't know how often I answer my phone and someone says, "Oh my God, are you a real person?" I'm
Yeah,
calling
it's
from
true.
right. I'm calling from
Yeah.
this area, but you just and do would you mind, of course, like one of my pet peeves was not being able to find those resources, not being able to link the individual, right? Because at least for me personally, you felt like you did a disservice. Like, I know I gave this person a number that's not going to work. That's horrible, right? But now actually being on that opposite end and being like, yeah, I'll help you. It doesn't matter what service area you're in. Yeah, I'll take your call and I'll patch you through to the right person. As a matter of fact, let me include them in the email and I'll include you as well. Right. But I so agree with that. I think again, part of the reason I really enjoy working in this service area, not just saying this, because I feel we really do make a difference. I know it's just our service area and it's little by little, but it's a huge big deal. It's a big deal to the community, bringing all these resources. Erika, Erika's out there every day. She could speak to this as well.
Yeah, I think just being able to like everyone was saying, and like we are all living in service area 7. We all been able to see it. We all know the different spots and places, even from resources to like maybe to go get a bite or something. But I think at the end of the day, you're able to create that relationship in the community. And I think school mental health is so crucial because families have to go through it. All of us went through the school system, and being able to have that accessibility is so crucial. And we have an eye on like kind of like the pulse of the community, like what's happening, in the community. Like now, you having a lot of the kids like having the tablet or the parents having it to like, navigate that. But I think it's really important to have a different way of maybe the way we conversate with each other. As for before, maybe the kid will bring a flyer to home and say something, and like now you could just go to the website and get it. And I think it's so great that we have that, because I think in service area 7, I think we're modeling what we wanted to be expected. And I know I've been part of SALT for maybe a year plus, and I've gotten to see that. So when I go and I talk to like, like Bridget and other people, it's like everyone's doing the same thing, because we all want to sound as one, so everyone can feel comfortable to have access to the services, instead of like, I already called this phone number 3 times, they're not answering me, or they don't speak Spanish, and I want to have talk to someone in Spanish. And it's good that now the numbers are updated. People do answer, people don't answer and tell you it's a pizza place, but it's an actual resource. Um, so, because I think even when I was before a clinician, I was a case manager, it was so crucial for me to give the client, like, you could call Mr. Roberto, and then he would be like, yeah. But if I were to just say, call this resource, it's not going to happen. And I've even seen it myself, even when I tell my dad to call the dentist. He won't call the dentist until I tell him who it is. But I think it's crucial to know, like you said, Bridget, we know the needs of the community, but we also know the strengths. And when you put those together, it's like putting a left and right leg. Like you'll get it walking and you get it moving.
True. And for me, it was a panaderia, by the way. So
Yes.
it wasn't a donut shop. Like, no, for me, I had called and the resource was now the number was being used for a panaderia. So as much as I enjoy a good pan dulce, I really needed that resource. So it was back to the drawing board.
Bridget, were you
I
like,
hear you.
what time does the bread
I
bake out?
know. I need the fresh
Okay.
one. El fresco, por favor. Yes.
So but I think, that's happened to all of us. Again, so many things. I can talk about this for hours, but I think Manny used the word navigating earlier. And I'm like, it is. We're navigating this for the community, right? Everything you're doing, you're trying to make this easier. We're trying to make it more accessible, trying to make these, us as professional, we know these resources exist, but to make it accessible and present for the community, I think
Right.
that's for me, at least that's where it's really at. I did want to ask you, Bridget, I I have a feeling you're going to be on this podcast plenty of times, because I know you're going to be heavily involved with a lot of different projects. But I did want to ask you, in terms of the school-based collaborative, what do you kind of envision for the future? What do you see? What would you like to do?
I think the vision is to be innovative, right? As we start talking about transitioning back to the office, in person work, doing something to serve the actual needs of service area 7. So just an example, right? Thinking of innovatively of like hybrid situations, right? Where because our service area is so big, and I think earlier we were chatting about traffic and how that is now a new reality for many of us. It's how do we cast that net wider, right? And how we do things innovatively to ensure that maybe a hybrid approach would be most appropriate, where we do both in person as well as offer it on Teams, so that way we can ensure that everyone has a seat at the table. So when it comes to the vision of school-based mental health collab, really ensure that yes, we're doing our due diligence, we're checking off the boxes, but how do we take it a step further to ensure that, we are, you know, putting the pieces together, really shifting from a disconnect of like, hey, we're checking off the boxes, to more so of like, okay, these are the 5 needs. I said four, Manny chimed in with the fifth one. And we talked about homelessness, and it's how do we put the pieces together now that we really have that foundation and those parameters, whether it's putting the puzzle piece in of the microsite, using our centralized email list that we now have up and running. So we're excited. We'll do a plug towards it, Tillen, where you can email us at, how to really use our meetings, right? And shift the paradigm from, hey, these are the barriers, to more so of like, these are some creative solutions on how we can have a plan A, plan B, plan C, which is right up our alley, right,
Mhm.
Jaime? This is the way that
Mhm.
we're like always thinking is like, hey, one, two, three, four, five, six, because this is how we're going to respond. So as we move in the direction of our leadership's vision, as well as, the needs of the community, you know, um, when we assess the needs of the community, it's like, how do we put the pieces together so that way we're able to respond appropriately? So that's my example, because I'm a concrete visual kinesthetic learner. And that's what hopefully is part of our newest endeavor in school-based mental health collab in service area 7. Yeah.
That's really cool. I again, I work with you all the time. But again, I've been really impressed. I have to go back with for saying that, like when I first started, right? We met briefly and we chatted a little bit, but I was still por decir, getting my feet wet, trying to figure out what my role was going to be within the service area, what I was going to do. But like having you back has really been a pleasure on my end. Like working with you, I'm like, let's do it. Whenever I see your email, I'm like, okay, let's see what we're gonna do next. Sounds cool. Let's give it a shot, right? I'm always very excited. I get I get very enthusiastic about it. I'm like, yeah, let's do it. But I'm not sure, Manny, Erika, I know we're running up on time. I'm not sure if you want to share any last questions, feelings.
No, I was just gonna say like thank you. I think if anything, it's been nothing but an honor, and I'm so glad that you shared some of the goals. And here in Service Area 7, like I think we're all here team players. So kudos.
Yeah, again, I'd just like to, say thanks again to both Bridget and Jaime. I know you've been working on developing these resources, but again, it's, going along with what you were saying, Bridget, about being innovative and creative. It's also a part of what you've been doing is being also flexible and really being able to hear what the community's saying, whether it's our provider network, whether it's the school-based system, whether it's the public health system or families or clients, and really being responsive and not always just like, well, no, this is what we're doing. We only have a resource for mental health services. But no, the community needs more than just mental health. We're one component in the service delivery system and the support system for the community. And I think that's really critical because it's in looking at the website again, not to shameless plug again for our microsite, but I do think that it's something that can be used by anyone. I grew up, born and raised in East Los Angeles, in Boyle Heights, and I came into the field of social work because I basically felt like throughout my particularly my high school years, I was already a social worker. I was talking to my friends and listening to their problems, and and the struggles that we all go through as young people, right? With parents and alcoholism and running away, drug abuse, foster care, abuse, you name it, all the different type of issues. And sometimes wanting to help and trying to help, but not knowing where to get that help. But with this microsite, it's easily accessible by anyone. It's like you don't have to be a mental health client. You don't have to be a mental health professional. You could just be a freshman in one of our local high schools and pull up the resource directory and see if you yourself need some kind of support, if you can connect somebody to some kind of support that's actually useful, instead of just having to, well, what, I don't know, why don't you go talk to the counselor, or being able to really access that information, I think, is critical. And what you both been doing in making that resource available to the community, I think it's again, it's really important work, particularly given the critical and difficult times that we're going through right now. So again, just wanted to say a big thank you to you both. And Bridget, thank you for everything that you're doing. I'm excited to look forward to all of the different collaboratives and work that you're going to be doing with all addressing the needs that are coming up. So it's exciting times.
So exciting. And one more plug, because I mean, we're here, right? It's a podcast. Um, it's really exciting to be able to hit the ground running in such a short time, because the work for Service Area 7 is extremely innovative. So much so that now I know that other service areas are using this model as not only their framework, but what they're actually implementing. So kudos to Jaime to ensuring that, countywide these needs are met, but also for using Service Area 7 as a model. We want to, we in our field, we talk about like being the holders of hope. And so if this is one way to hold hope for those that we serve, con todo gusto, as they say it.
I like that. I like that. Honestly, Manny knows me already. I don't take credit. I just do what I feel is needed, right? When I came in, I kind of like, what's the need? How can I put my skills, how can I put my skills to work? How can I use my skills to better support the team, right? Again, I can always just reference when I first came in to the department, I think one of my first assignments or whatnot was to work with the FSP navigation and just trying to figure out what can I best do to support that team? How can I bring my skills to fruition? But thank you both. I'm super grateful just to be a part of this team and to have the opportunity to work with La Señorita Brigida and Erika. Erika's awesome and Manny's awesome. I can't
Yes,
say enough good things
agreed.
about anybody on this team. I'll be very frank with you. Like, uh, everyone on this team has been super cool with me and super accepting. So I'm just very grateful. But thank you, and thank you, Brihada. You do again. You do an amazing job at what you do. I had the honor to pass by your cubicle one day, and I seen your monitor, and I'm like, oh, it almost looks like mine, but she needs another monitor. But with that said, thank you all for joining us again today. This was very enlightening. Again, I'm happy to have you here, Brigida, el señor Manuel Rosas, Mr. Rosas, Erika Corral. Thank you for being here. We're definitely going to continue. I'm hoping, of course, we're going to be doing more episodes of this podcast, bringing more information to our community, hoping to make our community members more aware of all the great services, teams, groups, you name it, projects that Service Area 7 is going to be bringing forward, reminding the community that we're here. And if you need support, please, by all means, reach out to our 1-800-854-7771 phone number, or you can now also text to 741-741. But definitely, thank you all for joining us here again from Service Area 7 Administration. This is Jaime Gomez saying goodbye and see you all next time. Bye.
Bye.